Folks, welcome back to the Steve Malzberg Show. This is a segment I've been waiting for quite some time. We are joined right now by the author of the #1 New York Times bestseller, also #1 on Amazon. It is the Obamacare Survival Guide. I hold it up in my hands, as you can see, those of you watching it at Newsmax. And it is the Affordable Care Act, what it means for you and for health care. It has been praised by the likes of Donald Trump. Newsmax says it is the best guide out there to help get you through and how to navigate Obamacare. And Nick Tate joins us right now. Hello, sir.
Well, hey, Steve. Good to be with you.
Well, it's my pleasure. Thanks for taking the time to be with us. You know, it's amazing. I just did a story out of Maryland where if you sign up for their version of Obamacare, their state health care plan, they tell you that the information could be sent to law enforcement and to auditors. If you did it in Kentucky, I guess I did a story, basically the same thing. They could send your information almost anywhere they want, including overseas. I mean, that's just one aspect of Obamacare that people probably aren't aware of as they go maybe looking for a health care plan.
Well, that's one of the concerns. They ask, the federal authorities ask for a tremendous amount of personal information, not just your income and what you do for a living, but what your health status is. Maybe if you've ever taken an antidepressant or have something that you would rather not be public, they ask for that information. It's part of the application process. You know, what I would say to you, though, is congratulations if you're able to actually get on the plan and see what's available. I've been trying for a week, and it keeps knocking me off. I can't even get on to see what the options are in Florida.
Well, right. Kathleen Sebelius was asked yesterday by Jon Stewart how many people have signed up. She wouldn't give the number. Jack Lew, the Treasury Secretary, was asked by how many people have signed up. She wouldn't give the number. Jack Lew, the Treasury Secretary, was asked by. This is overloaded from people who are curious.
Well, there has been a lot of interest in it. My suspicion is that a lot of the people that they're talking about who are trying to log on are actually reporters trying to figure out, what the deals are, what the options are. But, that's the thing. Part of what we're trying to do with the book is let people know that, whether you like it or not, here's the way you can navigate your way through and protect yourself as best you can. That's really what our goal is with the book.
All right. So, let's talk about someone who picks up the Obamacare Survival Guide, as so many millions of people have done. Tell me how it's formatted, because I know it's formatted to be very user-friendly and to be able to, people could find exactly what they're looking for their particular question at the time.
Well, this is a tremendously complicated law, 500 provisions, 2,500 pages, some 20,000 pages of regulations at last count. So there really is no one-size-fits-all solution to how to pick health and health care and insurance. So what we try to do is we've broken it down into specific chapters that appeal to and provide information and tips and advice for folks, whether you're a college student or a senior on Medicare, someone who runs your own business, or an independent contractor, head of your household. We try to provide very specific information because, as I say, there really is no one-size-fits-all solution to how to pick health care in this new landscape that's been created by Obamacare. And this is really one of those cases, I don't want to use a cliche, but what you don't know really can hurt you if you're not aware of what the programs are and what some of the mandates and the taxes may be.
No, absolutely. And the great thing about the Obamacare Survival Guide by Nick Tate, our guest right here on the Steve Malzberg Show, not only does it have a roadmap and information and lays out what you need to know for individuals and civilians like me, but also for the medical community, for medical professionals, and talks about the rule changes that they will need to know about and how the exchanges and everything that Obamacare mandates will affect them, correct?
Absolutely. Big changes are coming for healthcare. And, in some ways, people who work in the industry have some job security because they're going to be some of the guideposts that will help people to manage their way through. Everything changes. Medicare has changed. Medicaid has changed. There are new subsidies that people can qualify for, but it's still going to cost folks because they have to have insurance through some means. So, I don't think it's an overstatement to say that virtually everyone in every industry in this country will be touched in some way by these changes.
Absolutely correct. And we should point out that if you are interested, you could get this in any bookstore, at Amazon as well, and Obamacare311.com, Obamacare311.com is the website where you could go find out more about the book and order it for yourself. The book talks about, and people need to understand this, Nick, and you pointed out and spell it out so well in the book, that Medicare, long-term care, small businesses especially, they're going to be severely affected. So talk a little bit about those three aspects of life and how Obamacare might impact each one.
Well, Obamacare is a plan that doesn't just have an effect beginning January 1 when you will have to have insurance in this country or pay a fine. It really is a 10-year plan, and it affects everything from Medicaid and Medicare to individual health care. So in the short run, there are some nice sweeteners and benefits that the Obamacare authors have given to seniors in terms of closing the prescription drug donut hole and providing for preventive care. But in the long term, over 10 years, there's about $716 billion in budget cuts that are going to come down just as the number of seniors in this country qualify for Medicare. Something like 10,000 Americans a day are going to turn 65 in the next year or two and qualify for Medicare. And as that number rises, the amount of money going into Medicare is actually going to be held down. So the concern is, by many critics, that there are going to be some impacts on benefits. So you really need to stay informed. If you're a senior and you think that, or hope one day to soon be a senior, you really need to stay informed because there are some big changes that are coming over the next 10 years. That's why I say, the take-home message of this book really is you must be a savvy consumer. You can no longer just simply rely on what your company or your doctor or your insurer tells you that the story is. You really need to figure out what your best options are.
We've been told so much about Obamacare, the positives, and you point out in the book, to be fair, in the book Obamacare, the Obamacare Survival Guide, Nick, you point out that there are some positives, and I've said all along that Republicans should draw up their own plan, and instead of 2,800 pages, they should hold up 1 or 2 pages and say, here, the closing of the donut hole, you want to keep your kids on your insurance till they're 26, no pre-existing condition penalty, here's our plan, and you do point out the positives, or what many would consider positives, in the book as well.
Well, this is one of those topics. Obamacare is certainly a hot-button issue. People have strong opinions on either side. What we really tried to do is not take a kind of partisan approach one way or the other. We wanted to say, whether you like it or not, here's what's in the law, here's how it will likely affect you, and here are the changes that are coming your way. It is going to result in some massive changes in healthcare, so here's what they are. We tried as best we could to sidestep the politics. Now, I have my own opinions. Everyone does, but what we try to do is really provide information that would allow people to move forward. You're making a good point, though. I mean, Bill Clinton, I will say, a month ago was tasked by the White House to give a speech to make the case for Obamacare, and while he certainly did that, and as we all know, Bill is somebody who, the former president, is somebody who sometimes speaks out of turn or acts out of turn, as the case may be. But even he was saying that what we need to do is figure out how to move forward and figure out what really works in healthcare reform, bring both sides of the aisle together, both sides of the divide on Obamacare, and say, well, we like this, we don't like that. This works, it's demonstrated. Let's see if we can fix some of the problems. So I'm thinking if even Bill Clinton will step forward and say we need to find a better way than the warring that's been happening, it suggests to me that that's the way we have to go. But based on what we heard today from the president talking, and I just don't see that kind of kumbaya moment coming anytime soon.
Neither do I. We're talking to Nick Tate, the author of the Obamacare Survival Guide, here on the Steve Malzberg Show. One more question. We have 2 minutes left. Prescription drugs. Practically everybody in this country is on one prescription drug or another for whatever reason. You have you detail it brilliantly in the book. Talk about briefly in about a minute and a half some of the changes as far as prescription drugs are concerned.
Well, there are a couple changes I would mention. First of all, there are some new benefits for seniors in prescription drug coverage, but there are some losses that folks will also experience if you have flexible spending accounts or HSAs. There are new limits on what you can use that money for. These are for out-of-pocket expenses for things like drugs. So as more people are taking medications as we get older as a society, the aging of the baby boomers, I suspect the increasing costs for drugs and insurance and health care in general are going to continue to rise. There's really nothing in Obamacare that holds down costs for drugs or health care in the long term or even in the short term, and there's nothing that prevents insurers from passing on those costs to businesses and individuals in terms of higher premiums. And in fact, that's already happened in the 3 years since Obamacare has passed.
Right.
Both costs and insurance have gone up, and I suspect that's going to continue.
All right, Nick, it's the most comprehensive, easy to understand, complete and thorough explanation and really survival guide of Obamacare, and I think everyone needs one of these in their home. It's the Obamacare Survival Guide, the Affordable Care Act, and what it means for you and your health care by Nick Tate. and you could get it at Amazon or the bookstores, and, of course, at Obamacare311.com. Thank you, Nick. Appreciate your time, sir.
Thank you, Steve. Appreciate it.
My pleasure. All right, here he is, best-selling author, #1 in the New York Times, #1 on Amazon, and Newsmax says that it is the first and best roadmap for you to understand the new law, and every American is affected by Obamacare, so the book is essential to you and your family. I couldn't agree more on the Steve Malzberg Show, Newsmax TV and radio.